called an antibiotic. When antibiotics are prescribed, it's extremely important to take all of the medication prescribed for the entire length of time that it has been prescribed for. If the antibiotic is stopped too soon, some of the pathogens may remain and become resistant to that antibiotic. Certain pathogens have become resistant to the antibiotics that are most commonly used against them. There are serious problems controlling infections in healthcare facilities. When these pathogens become resistant to an antibiotic, those that are still effective are often much more expensive than the others were, and also may have much more serious side effects compared to the previously prescribed antibiotic. It's possible also in time that the pathogens may develop a resistance to these newer, more expensive antibiotics. Two groups of pathogens have become resistant to two of the most powerful antibiotics that we have. These antibiotics are called methicillin and vancomycin. The organisms are called methicillin-resistant Staphylococcus aureus. That's a long name, more commonly referred to just as MRSA or as MRSA. This pathogen is found normally on the skin and the mucous membranes. The other type of organism is called vancomycin-resistant enterococci, another big term that is more often called just VRE. This pathogen is found in the stomach and intestinal tract, but both are major causes of hospital-acquired infection in healthcare facilities today. People who develop one of these pathogens have very limited, if any, antibiotics that are available in our arsenal to combat them. There are actions and procedures that can help prevent the transmission of infection to protect yourself, your coworkers, and the people within your care. Although it's not possible to eliminate all pathogens from our bodies and environment, there are measures that can be taken to help reduce them. Medical asepsis refers to medical practices that reduce the number of pathogens or interrupt the transmission from one person to another. Many actions and procedures can help prevent the spread of infection. Most will be discussed in another tape. Hand washing is the most important procedure we can do to prevent the spread of infection. Please watch now as a nurse consultant in infection control speaks about hand washing.
Hand washing, of course, is the most important task that any of us can perform in our duties of caring for residents. This hand washing prevents the spread of germs that can cause infection. And think of germs as those small little microorganisms that I talked about earlier. You must wash your hands for at least 15 seconds, and I recommend 30 seconds. You must cover all surfaces of your hands by washing, making sure you get in between the fingers. If you think that underneath your fingernails have become contaminated, you want to use a file or some sort of a tool to clean underneath your nails. But make sure when you're finished soaping up, you rinse well under clean, tepid water. You also want to make sure that you put your hands down so the germs in the water are going off of your fingers, not up your sleeve, because that can cause you to have potential infection if your hands have been badly contaminated. The type of towel that you would use to dry your hands, I recommend that you do not use cloth towels. If you do, use them one time and throw them into the laundry. You do not want to have 5, 10 different people. You probably don't have that many people working in your facility, but if you did, you don't want to have 5 or 10 different people handling that wet towel and drying their hands on it. The wet towel can promulgate germs, and also, you don't know if your coworker has washed their hands properly and actually applied the germs onto the towel. What about wearing gloves and hand washing? There's a lot of confusion out there as to what to do when you're wearing gloves. Do you still need to wash your hands when you're finished with the gloves? Do you need to wash your hands before you put the gloves on? Well, we'll go over that now. Certain guidelines are set forth by the regulations and must be followed by all employees. You must wash your hands before applying gloves. That is mandated in the regulations. You must wash your hands when removing gloves, even if you feel your hands have not become contaminated. Gloves are not impervious, and what I mean by that is gloves have very minute, small holes in them. So if you are dealing with stool or urine or blood, you may in fact contaminate your hands even though you have gloves on. So don't feel so secure, well, I had gloves on so I don't have to bother washing my hands. That is not proper according to the regulations. It doesn't matter whether you wear latex or vinyl gloves, they still have that same potential to have the small holes in them where germs could sneak through and get on your skin. It is the responsibility of your employer to have a location for hand washing available at a reasonable distance from your normal work area. So that would make it easier for you to wash your hands conveniently in a routine basis. So you don't want to be working in one hallway and you have to go all the way down another hallway or around or upstairs, downstairs to wash your hands. So this is the responsibility of your employer. So if this is a problem, you might want to discuss that with them. When do you wash your hands? You always wash your hands before you start working, before taking care of a resident or a patient, before you eat, before handling clean linens. You want to get into clean beds, so you would expect your residents or your patients to get into a clean bed also. You always want to wash your hands after taking care of a resident, no matter what kind of chore or duty you have provided to that resident. The end of your workday before going home. You want to make sure that when you leave your workplace, you have decontaminated your hands and you're not taking germs into your automobile, or if you stop for an ice cream, or home to young children that you may be picking up at a babysitter. You don't want to contaminate your family. You wash your hands after feeding a resident. You may think, oh, I'm not having any problems. I didn't get any food on my hands. It's still potentially possible that resident could have passed on some germs to you through their food, through spitting or whatever, wiping their mouth with a napkin. So you want to make sure you wash your hands before you move on to another task. After eating yourself, you want to wash your hands, especially if you have a cold or a little flu or some kind of virus, but you've still gone to work. You want to protect yourself and your fellow employees and other residents of your facility from passing on those germs. After toileting, this is a mandatory thing. When you go to the toilet, you must wash your hands properly with soap and water. Just putting your hands under a little bit of water and rubbing them a little bit and then drying them on a towel is not cleansing your